Okay, so today I am going to be talking about what autism looks like in children for the purpose of being able to identify certain behaviors based on whether or not a child's meeting developmental milestones so that you can make a referral for the child to be further evaluated by a physician or a psychologist or some other professional that is able to make that determination. So we're going to start by talking about what is autism. Defined by the DSM-5, it's the persistent deficits in social communication and interactions. So they might be uncomfortable or just not know how to interact with another person, or maybe just not interested in it at all. Very restricted and repetitive patterns of behavior, interests, or activities. So really fixating on certain things and having to have things a certain way, or else they might feel like stressed out or frustrated. So these symptoms will be present most often in early developmental period, and they must be causing clinically significant impairment in the child's social functioning. So maybe that's at school or at home or any other environments that they might be in. And these symptoms are not better explained by any type of intellectual disability. So the persistent deficits in social communication and social interaction, this is that difficulty with social or emotional reciprocity. So they might not share interests with others, they might not be able to reciprocate emotion. Maybe the mother's hugging the child and the child is not interested in reciprocating that affection. And it's also a failure to initiate or respond to social interactions. So they're not going to go up to show their mom this toy that they have. They're maybe not able to ask for help. It could look like a lot of different things, but those are just examples. There's deficits in nonverbal communication as well. So the child would avoid eye contact. Their body language or gestures might be misinterpreted or their facial expressions. Either they're not able to understand someone else's body language or gestures or facial expressions, or they're not able to demonstrate those things themselves. There's also deficits in maintaining and understanding relationships. So there's not really that interest in peers or making friends. For example, a child I used to work with, we really had to work with him on getting him to interact with peers because he was very content sitting off in the corner by himself, reading a book or playing with dinosaurs. He didn't like how other kids played with the toys. There was a certain way that it had to be done. He wanted it done that way. He'd go so far as to wait till the child would leave him alone, and then he would take that toy the child had and redo that play the way he wanted it to be done in the first place. So he really had a hard time making friends. Something that I definitely worked on with him and was able to overcome to some degree, but that interest wasn't there naturally. So the restricted repetitive patterns of behaviors, interests, or activities. So this could be repetitive motor movements, wanting to use the same type of object or saying the same words over and over and over again, wanting things to be the same and really struggling when things are different. So when routines are different. Ritualized patterns, that kind of goes into what I was saying about wanting to play with something in the same way and getting upset when it's not how they expected it to be. Restricted or fixated intense interest. For example, the child I was just speaking about, his thing was dinosaurs and books. He loved anything, and if it's a dinosaur book, even better. Really wasn't open to what other children wanted to do with him. It was dinosaurs and books. There was also the hyper or hyporeactivity to sensory input. So for this child, noises were incredibly overwhelming for him. It almost looked like he was in pain when a loud noise would happen. He would try to run away from the situation. He would scream himself at the top of his lungs. He really struggled with loud noises, but there's also other children where it's not noise that bothers them. It could be light, or maybe they like bright lights or they like noise. It's just different depending on the child. So with autism diagnoses, there are 3 levels of severity. Level 1, child requires support, but can probably, without supports in place, they would probably really struggle with communication. There would be some noticeable impairments. They would have difficulty initiating social interactions, tend not to have interest in social interactions, so just would probably need a little bit of guidance, but could probably do those things with some support. Level 2 is a person that requires substantial support. There are pretty clear deficits in verbal and nonverbal social communication skills. The social impairments are apparent even when there are supports in place. Not so much initiation of social interactions, inflexible behavior, difficulty coping with change, or other kind of like restrictive, repetitive behaviors. And then there's just distress or difficulty changing focus or action. And then for level 3, somebody with a level 3 diagnosis, that's somebody that's going to require very substantial support. There are severe deficits in verbal and nonverbal social communication skills. This is really severely impairing their functioning across a variety of settings in initiating social interactions. And then there's, again, the inflexibility of behavior, extreme difficulty with coping with change, restricted, repetitive behaviors, and that's across all spheres of their functioning. And again, the difficulty and distress with changing focus or action. So learning the signs of autism can be really important when we're going out into homes, because it's very possible that parents aren't aware that their child isn't developing normally, especially if they don't have another child that they could compare their behaviors to. So the signs of autism are usually apparent during the first 3 years of life, but could be diagnosed as early as 1 year of age. It appears that there's 4 times more of a prevalence in males than in females. Since there's no medical test to diagnose autism spectrum disorders, it's based on observation of the child's behavior. So learning these signs gives us the ability to point these things out to parents, talk to them about things that they notice in their child's behaviors, and that way we can make referrals so that if this child does need interventions, we're able to facilitate that. So why even make the referral? So research has indicated that early and intensive treatment leads to a better prognosis for the child long term. So the sooner that we're able to get the child into programs such as like individual education programs, IEPs, that's the sooner that we're able to start improving their functioning across a variety of settings, whether that's school or at home or just out in the community in general. So we're going to talk a little bit about the different developmental milestones and across just certain ages, and if we're not seeing certain things, if we are seeing certain things, those could all be indicators that the child would have an autism diagnosis and would need some kind of further evaluation to determine whether or not there is a diagnosis to be made. So by 6 months, if the child isn't smiling, like no big smiles, or it's very infrequent that the child is smiling, if there aren't like joyful and engaging expressions of the child, maybe between the mother and the child, or really anybody, no eye contact or really limited eye contact, that would be a time that you would want to make a referral to a physician or another professional that is able to make the diagnosis, determine the diagnosis. At 9 months, if there is not that back and forth reciprocation of like sounds, smiles, facial expressions, that's probably a good time to refer also, because at this point you would be seeing, if you're smiling at the baby and baby's not smiling back, that could be an indicator. Now, all these things don't necessarily mean that the child would have an autism diagnosis. It's just something that maybe raises the red flag that they might need further evaluation. By 12 months, if there's not really any kind of babble, back and forth gestures, so that reciprocating of gestures, so pointing and showing, and if they're not looking where you're pointing, or you're waving to the baby or the child, and the child's not waving back to you. If they don't respond to hearing their name being called, by the age of 12 months, that's something that you would want to further evaluate. By 16 months, if their vocabulary is very few words or no words, that would be a red flag. And if they're by 24 months, they're not making any kind of meaningful phrases that's at least 2 words. So that's not including if you say something to them and they imitate it or repeat it. It's more so probably something like you're being around food and the child says, "I'm hungry." It wouldn't be, "Don't touch that," and then they say, "Don't touch that." That wouldn't count as a meaningful phrase. So if you see any of these signs at any age, a referral should be made. So if they previously had some skill, whether that's speech or some kind of social skill, and they seem to have lost it, that would be a time to make a referral. If there's ever avoidance of contact, difficulty understanding other people's feelings or emotions, if it seems that their language development is delayed, if they're repeating words and phrases persistently, if their interests seem to be very restricted and only wanting to focus on one type of thing. And I have a video that'll show a lot of these that we're going to watch in a slide or two. Inflexibility to changes in routines or surroundings, repetitive behaviors like rocking or spinning, other ones like flapping their hands, intense reactions to sounds, smells, taste, texture, so intense reactions to sensory things, and if the child is avoiding or resisting any type of physical contact. And just overall, the American Pediatric Academy, they recommend that all children receive screening for autism at 18 and 24 months. So you made the referral. Now what's going to happen? And this is important to know because if you're referring a child to be further evaluated, when you're talking to parents, they're kind of going to wonder, like, well, what is this for? What's it going to look like? What do we do next? And one thing you can let them know is that they're going to do screenings. And there is a screening that a parent could do from home if they were just curious before taking them. It's a modified checklist for autism in toddlers. And there's a paper version, but there's also an online version. And what they can do is it walks you through the questions. So, for example, if you point at something across the room, does your child look at it? So if it was a child that had autism, the answer would most likely be no. And it'll take you through all of these. So have you ever wondered if your child might be deaf? So maybe the parent notices that the child doesn't answer to their name. So you'd say yes. So it's going to walk you through each of these questions, and then it'll give you an assessment at the end. And it's 20 questions long. But this might be a good thing that you could pass on to the parent just in case they're kind of confused, they're not really sure whether or not their child might be able to be diagnosed with autism, but it just gives them kind of the ability to take a first step and look into it once you make the referral. It's less of a, I guess, confusing process, or there's a little bit less uncertainty about what's going to happen. So this is the paper version of the same assessment. This has all the questions on it. So does your child walk? When you smile at your child, does the child smile back at you? A lot of questions that have to do with the symptoms or the signs and symptoms that we talked about. So this video is going to show us a comparison between children that are developing typically versus atypically. So we're able to recognize the early signs of autism.
I'm Rebecca Landa, Director of the Center for Autism and Related Disorders at Kennedy Krieger Institute. You are about to watch a brief tutorial illustrating the early signs of autism spectrum disorders, or ASD. You will see 3 pairs of videos of 1-year-olds. Within each pair, you will first see a child with neurotypical development, followed by a child who shows early signs of ASD. The developmental features indicative of ASD shown within these videos fall into three main categories. These include effective communication and sharing enjoyment, making social connections, and the one with which we will begin, seeing social opportunity through play. This 19-month-old child does not show signs of ASD. He has chosen to play with the balls. He quickly integrates the lady into his play. He pretends that the balls are food and offers a bite to the lady.
He pretends a lot of stuff is food, and he always wants you to eat it to you.
Okay. You're making some yummy food.
He understands that food, spoons, plates, and eating go together. As he creates a pretend play activity, he remains aware of the people nearby. He enjoys incorporating social interaction into his play and offers the lady a bite.
Thank you. That sure is tasty.
He is able to pay attention to the lady, the doll, and the pretend food all at once. He shares his excitement about the toys with the lady, looking at her and smiling. After the lady comments that the food is hot, he links his play and language to her idea.
It's okay, no, it's cool. It's nice to see them. Yeah.
Here, he imitates the lady's action with the pretend lipstick.
My lips pretty now. My lips always doesn't come off.
This helps him to learn new play skills and at the same time synchronize his actions with the actions of others.
Yeah, she has lipstick on. Oh, just like Mommy wears. You look so pretty. Thank you.
This 19-month-old child shows signs of ASD. He has an intense interest in the toy phone.
Toys R Us is
He does not share his enjoyment of the phone with others. He does not look toward others and smile.
Shows, sensory all kinds. He really has this addiction to telephones lately. It's okay though, because it's helping him to make sounds. So there's probably like 10 telephones laying around my house because he walks around carrying them and sits them down, and then he goes on to the next one.
Although he puts the phone to his ear, he does not show creative play with the phone. When his name is called, he does not respond.
Elliot. Ellie. Ellie. Elliot.
He does not offer the phone to others so that they can have a turn.
He would turn to his name, and progressively he's not.
His mother tries to distract his attention away from the phone.
Let mommy see the phone. Let mommy see it. Let mommy see the phone.
There you are.
She begins to tickle him. Although he seems to enjoy the tickling, he does not look at his mother or make a social connection with her. He does not try to communicate with his mom to keep the social game going. This 14-month-old child has a mild motor delay but does not show signs of ASD. As he explores the new toy, he remains aware of the people nearby. He checks in with his mother behind him to ensure that she also sees the toy. Next, he shows that he understands the social communicative meaning of the woman's pointing gesture by immediately looking at the sticker. Then he looks over at another sticker she had pointed out before. He continues the woman's topic of communication as he points to the ticker sticker. He shows the motivation to maintain social engagement with others and the ability to communicate using coordinated gaze, vocalization, and gesture. This 14-month-old shows signs of ASD. First, he flaps his hands while enjoying the bubbles. He does not share his enjoyment by looking at the man. He does not respond to his name.
Ben. Ben. Ben.
Although he looks at the man's pointed finger, he does not follow the direction of the man's gesture to locate the object of the man's attention. This 14-month-old does not show signs of ASD. While she enjoys looking at and exploring the toy, she stays engaged with the people nearby. She tries to share her enjoyment with her mother as she turns to show the toy to her. Then, she shares her enjoyment with the lady across from her by directing her gaze and smile toward the lady. Also, she recognizes that the lady is a source of help. Her request for help is clear and effective. Coordinating eye contact, gesture, and vocalization for purposeful communication is a sign of healthy social and communication development. This 14-month-old child shows signs of ASD. Notice how his attention is so focused on the toy that he does not interact with the people nearby. He does not share his attention with others. His exploration of the toy is also unusual. He drops the toy onto the table and watches it move. When the toy stops moving, he does not use eye contact, vocalization, or gesture to ask for help. He also tenses his body and mouth in an unusual way.
Again?
Even though the lady is talking to him, he shows no interest in her. He does not seem to understand that her gesture is an offer to help him. He does not check in with the lady or his mother to see whether they are paying attention to the toy that he is enjoying. ASD is a neurodevelopmental disorder affecting multiple aspects of development, especially social and communication skills. Children with ASD often show unusually intense interests in certain objects or sensory experiences. They may repeat certain behaviors over and over again. The signs of ASD are not transient, but rather persist over time. The earliest signs of ASD are often subtle and become clearer in the second and third year of life. A diagnosis of ASD should be made by one or more experts who gather a thorough developmental history, directly assess the child's developmental abilities, and conduct a medical exam. For more information about ASD early detection and intervention, or to sign up to receive our newsletter, please visit autism.org.
I have one more video. This one is from the perspective of a parent, and they have multiple children with autism. They had done a video prior. This is their most recent updated one. And again, this is a more visual representation of a lot of behaviors that you might see with a child with autism. And hopefully in seeing these, we're able to recognize them when we're actually out visiting families in their homes.
least tempted. This second example can be confusing to some, as most people have at least attempted to walk on their tippy toes at some point in their life. Again, pay attention to how often the child does the behavior. Our 9-year-old son, who was diagnosed with autism, still walks on his tippy toes to this very day. This third example may seem alarming. However, as long as they bang their head on something soft, like this padded high chair, generally they'll be okay. As a form of stimming, it can help calm the child due to the rocking motion. Many people with autism like to rock back and forth. We also show Alistair banging his head on the glass door and on the ground to show you different examples. However, after recording the footage, we promptly removed Alistair from the situation and redirected his attention to avoid any potential damage. Some people even need to buy football helmets for their kids, it gets so bad. This fourth example may not seem so odd to parents and others. After all, hasn't every kid been fussy in public at some point? But this behavior has less to do with not getting a treat or a toy, but due to the loud, bright conditions of most public settings. While it may be hard to distinguish sensory fussiness or meltdowns from common temper tantrums, an easy way to tell is this. When you give your child what they want, do they stop the bad behavior? If so, it's probably them just throwing a typical tantrum. However, if they continue to fuss, scream, and cry, as if in pain, even after they get what they want, then it's probably a sensory-related tantrum or meltdown, as most people call it. Although I don't recommend giving into a child's demands, I think this exception can help once in a while, as it can be very revealing. Also, most common tantrums last minutes, whereas a sensory meltdown can last hours. Oh, buddy, I love you. Hard time. We'll get you home, okay? In this fifth example, we see another example of stimming. While every child loves to play with water and blow bubbles in their milk, the key here is, again, how long does this behavior last? Also, you may notice that your child is doing this behavior alone, withdrawn from others, instead of trying to put on a show. Generally, the behavior will last longer than 5 or 10 minutes and can last hours depending on the severity of autism. Look for extreme obsession and repetition with objects. And number 6, we have very aggressive behavior. All kids fight at some point. But is your child doing this immediately after being punished, as if they are enjoying it? It may seem odd, but this can be another form of stimulation, as they get a strong response from others when they are aggressive. You will notice the child being much more aggressive than a typical child for no obvious or good reason, like wanting something another child has, such as a toy. Alistair, can you use your words? What do you think about the car wash? At number 7, we have a lack of response to voice or sound. While every child has ignored their parents at some point, usually out of spite, you will notice an autistic child being aloof, as if in their own little world. Sometimes parents think their little child has hearing problems at first, but this has more to do with being withdrawn than not hearing. If anything, autistic people hear too much and have a hard time filtering out noises. Alistair, what are you playing with there, bud? Playing with a car? Sit down. Alistair. 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 Alistair, I'm talking to you. Number 8 is probably the most well-known sign, and that's the lack of eye contact. Most people with autism will avoid eye contact whenever they can, and many describe it as painful. While the specific reasons can vary from person to person, this is definitely a strong sign that autism is. Many describe it as painful. While the specific reasons can vary from person to person, this is definitely a strong sign that autism is present and usually persists into adulthood. Number 9 is missing speech milestones. If you don't know the general rule for how many words your baby or toddler should be using, then it's only a quick internet search away. Generally, if your child is only using a few words at age 3, there is cause for concern. If your child is 4 or 5 and is still not using basic sentences, there is a great cause for concern. Also, echoing words, or echolalia, is when they constantly repeat the same phrase, not in a learning way, but more like a broken record way, again and again and again. So be aware of that too. It's been saying the same thing for the past 20 minutes, right? Finally, not all people with autism are nonverbal. Just because your child may be talking doesn't mean they're necessarily out of the woods. Number 10 has to do with problems in food or textures. Many people with autism are picky eaters, which ties in with the sensory issues. Some hate the feeling of yogurt or dislike their food touching other food. While this sounds like typical child behavior, it's on a much higher level. If you offer that food to your child, even if they are clearly hungry, they won't eat it even to save their lives. Fortunately, our son Alistair passes this test mostly. He loves all kinds of foods. He is much more picky with textures like clothing tags and scratchy shirts. Our older boys who have been diagnosed with autism still love to wear their clothes inside out to avoid clothing tags or odd textures. Alistair loves the feel of flannel and likes to wear hats for the feeling of security it gives him. While we didn't get to cover all the signs and symptoms of autism, we hope this gets you started in the right direction. If you seriously think someone you love has autism, please reach out to a local psychologist, neurologist, social worker, or other professional. The sooner you get your child help, the greater chance they will have adapting to society and its many social customs. On that same token, please continue to help those with autism by educating yourself and others.
So as we saw, there really are a lot of different ways that autism can present itself. And using videos like these or looking up additional resources, you could really prepare yourself for when you are going into homes and doing your assessments, especially when we're assessing for child functioning, looking for these certain indicators that could be signs of autism, but we need to make sure that when we're out there that if necessary we're making appropriate referrals for whatever they might need, and in this case they would be for evaluations relating to autism. So these are just resources used for this assignment, and that's it.